Welcome back to our second video series on constipation. Let's go ahead and find out the role of the colon, what it looks like, and how it works. Most literature states that the colon is anywhere from 3 to 5 feet in length. Layers of muscle line its wall. The muscle layers are both circular and longitudinal. The muscle contractions produce movement or motility that helps propel the stool through the body. There are 4 main functions of the colon. It absorbs water and salts from the waste. It moves or propels the waste through the colon. It stores waste until it's expelled. Eventually, the waste is evacuated. This is a perfect illustration of what the colon looks like. The colon actually looks like a goalpost. The right-hand side of your colon moves up the right-hand side. It's called the ascending colon. The transverse colon moves across the upper part of the abdominal area. Your descending colon is the left-hand side. It goes out the sigmoid colon and down the rectum. Over here, we have a gentleman that looks like he's just getting out of bed in the morning. We really encourage our patients to stretch before they get out of bed in the morning. That increases the heart rate enough to where that blood flow goes to the stomach, and it helps produce those peristaltic contractions, preparing the colon to have that first evacuation of the day. Another helpful hint we encourage our patients to do is always eat breakfast. We encourage patients to eat breakfast within that first 30 to 45 minutes of getting up. That really stimulates that colon, again, helping us to have those timed, predictable bowel movements. Back over here at the picture of the colon, you can see the small bowel sits right in the middle of the colon. It empties liquid stool into the right-hand side of the colon. The colon holds anywhere from 8 to 10 cups of liquid stool in a 24-hour period. The mechanism of the colon is to start pulling that water off of the stool to make it a firm stool. You can see the motility of the colon as it propels that stool up. You have these little peristaltic waves that are always producing movement and increasing the movement of stool through the colon. Up here, same thing. You've got that motility going on. Looking here on the left-hand side of the colon, you can see where that colon is getting really skinny and it's propelling that stool into the rectal vault. This is actually called a mass peristalsis. We have about 6 mass peristalsis per day. It increases when we get up in the morning or after we've had a meal. This actually produces our bowel movement. It pushes that stool into the rectum. Once that stool hits the rectum, we develop an urge. Here we have an illustration of that stool actually sitting in the rectum. Once that stool hits the rectum, the stool distends the rectum, developing our urge, indicating to us that we need to go to the bathroom. Once we get to the bathroom, we are beginning to evacuate our stool. Our sphincter muscles stay completely relaxed and we evacuate our stool. Looking at this gentleman here, it looks like he is in the wrong seated position when having a bowel movement. We really encourage our patients to sit more upright when they have their bowel movement. We also encourage our patients to use a footstool so that they can get their feet up a little bit higher so their knees are higher than their hips. This picture actually shows an excellent position that a patient should be sitting in while they're having their bowel movement. Again, if you'd like to put a footstool under your feet to get your knees a little bit higher than your hips, that's going to help with that evacuation of the stool. When you're done with your evacuation, your rectal vault should be completely clear. Your sphincter muscles return back to resting position. This concludes the first 2 videos in our series on constipation. We've gone over the common causes and symptoms of constipation, the role the colon plays in constipation. Now we're going to be moving on to video 3 and 4, which is going to include lifestyle modifications and helpful hints.